If you're a senior and you're struggling to afford food, let's talk about your eligibility for food stamps or how to increase the benefits you're currently getting. There's a lot of misconceptions around food stamps that causes a lot of seniors to miss out on benefits that they're eligible for or deserve. I'm going to talk about 10 of those misconceptions that could help you get the benefit that you're eligible for, or maybe costing you money if you're not paying attention. And watch till the end of this video because I am going to talk about Medicare. If you are turning 65 soon or you're already receiving Medicare, there are some rules and information I'm going to share with you that is going to help you save about $1,100 a year if you are considering moving out of state, if you are trying to stay in your job or you're leaving your job and you're a senior turning 65. This is critical information for you. My name is Kwame Kwade. I am an entrepreneur and a personal finance expert. For 15 years, I've been helping seniors get the benefits they deserve. We started out with websites on Social Security, food stamps, Medicare, Medicaid, personal finance in general, and lately we've been adding video content. I'm also an adjunct professor. I teach entrepreneurial finance to graduate students at one of the most prestigious universities in the country. If you're new here, hit the like button, hit the subscribe button because we do appreciate your support. And as always, during our broadcast, we like to know where you're watching our video from. So hit me up in the comments. Let me know your city and your state. So let's dive into this important topic that could save you money or is robbing you from the benefits that you deserve. So let's talk about SNAP. SNAP is otherwise known as food stamps, and it's one of the best anti-poverty programs in the United States, helping people who need food be able to afford food to supplement their current budget. For every $1 of SNAP that it spent, it creates economic activity of about $1.7. And there's been declining enrollment, and part of that is also that seniors that qualify for benefits do not apply for benefits that they are eligible for. So I'm going to talk about some of the misconceptions that are out there that prevent seniors from applying for food stamp benefits that they're eligible for. So if you're 60 or older, you may apply for SNAP even if your income is higher than the normal standard for food stamps. And seniors have special deductions for medical expenses and can have higher income limits or asset limits than the regular population. And if you're a senior couple, you can apply separately from other people in your household. And many working seniors and those receiving Social Security can also qualify for food stamps. Now, a lot of people think that Social Security or food stamps is just for people who are extremely poor, but that is not true. A lot of working families actually are on food stamps because of cost of living is so high, they cannot afford the food that they need, and so they need help affording food. And I think that the reason why a lot of seniors don't apply is that they think that it's only for people who are extremely poor, but that's not the case. Working class people are applying for food stamps in record numbers because it is hard for them to afford the food they need because food prices have gone up and stayed up. And if you've been paying attention in the United States, inflation has been rampant for the last few years and everything has gone up by 30, 40%, making it difficult for people to afford food. Now, getting approved for SNAP can automatically qualify for you for other assistance programs, especially for seniors. Things like the Lifeline program, which gives you access to discount on cell phone services and internet service, affordable connectivity program, and energy assistance. Now, though there may be as restrictions, you may also use your SNAP benefit to buy seeds and plants to grow your own food. This allows you to grow vegetables, fruits, and herbs at home. And you may also even buy gift baskets with food stamps, as long as what is in the gift basket, 50% of it is food. And one amazing way for seniors to save with their food stamps is to use it at participating farmers market that helps them double their food stamps benefits. That program is called Double Up America or Healthy Bucks or Fresh Bucks, depending on where you live and what programs are available in your local area. Now, let's talk about health and financial benefits, why it's important for seniors who are eligible to apply for food stamps. Healthier eating. SNAP benefits help seniors afford fruits, vegetables, and other nutritious food With extra grocery money, you can buy more healthier food. Also, it lowers healthcare costs. Seniors with SNAP incur about $1,400 a year less in annual medical costs. This has been proven by survey. Better nutrition leads to better health outcomes and fewer hospitalization. And SNAP benefits are 5.3% less likely to skip medications due to cost concerns. A lot of seniors are weighing between buying food and buying medicine. If you are approved for food stamps, now at least the food part of your headache or your frustration or things that are bothering you is covered, and you can spend your money on the medication that you desperately need. And then it also helps you stretch your budget. The average SNAP benefit for an older adult is $108 per month. It may look like nothing, but at least, even if it's one trip to the grocery store, it saves you money and helps you stretch your Social Security and other retirement benefits. A lot of seniors are not sure or are not really educated on where they can use their food stamps. In addition to grocery stores, there are many, many places you can use your food stamps: farmers market, convenience store, and even farmers stands. And shopping at food salvage or discount grocery stores can also help you stretch your budget. These stores are often they sell branded name stuff that can help you significantly reduce your food costs. Another thing is the restaurant meals program. There are 9 states that offer the ability for seniors to be able to use their food stamps to buy hot food, which is prohibited. But if your state offers the restaurant meals program and you're approved and you're a senior, you can use your food stamps to buy food at hot restaurants or fast food places. And here's the thing: if you have mobility issues or you have challenge preparing your meals, this could be an option. And then there's the community supported agriculture. You can use SNAP benefits to purchase GSA subscriptions from participating farms. This provides regular delivery of fresh seasonal produce directly from local farms. Now, one of the misconceptions is how to manage your benefit. Your unused SNAP benefits roll over from month to month, but you don't have to wait long to use them. Benefits will be removed from your card after 274 days of non-use, 9 months. And authorized shoppers: if you have difficulty shopping, you can designate a caregiver or family member as an authorized shopper. Contact your caseworker to add this person to your account. So if you have benefits and you can't get out to go shop for yourself, you can have your caseworker add somebody as your designated shopper or authorized user, and they can shop for you even online, on Amazon, on Walmart, to buy groceries, and they can use Instacart or DoorDash to get them delivered to you. And in many states, renewal for food stamps are very easy for seniors. Many states have simplified renewal processes for seniors. Some offer longer certification periods, meaning that when you get food stamps, you don't have to requalify again for 36 months. That is all designed to make food stamps benefits easier on seniors. And then if your application is denied or your benefits are reduced, you can appeal. This happens to a lot of seniors. When your Social Security benefits go up, you lose your food stamp benefits or they are reduced dramatically. You can appeal within 90 days of receiving the notice. And then let's talk about SNAP and other programs. If you qualify for SNAP, you may also qualify for help paying for Medicare premiums. In some states, that could be a huge, huge help. Medicare Savings Program can save you more than $1,700 annually by covering Part B premiums. Property tax relief. Many states offer property tax relief programs to low-income seniors. Your SNAP participation may streamline qualification for these programs. Utility assistance. SNAP recipients often qualify for low-income home energy assistance. This helps with heating and cooling in critical months during the year. And then free technology access. There are programs out there like the Lifeline program that offers you access to free internet or free phone service that helps you save money on your monthly utility cost. Now, here are some tips for seniors on applying for food stamps. You can apply for SNAP by phone, by mail, or in person. Most states offer user-friendly help for seniors to apply online. You can contact your local legal aid, food bank, and other senior centers that have support in help you apply for food stamps. But before you apply, make sure that you've prepared all your documentation, because this is where a lot of seniors fall short. Your medical bills, all those things, some of them can be deducted. Your housing costs can be deducted. So make sure that you're getting all the deductions, because why is that important? Because your deductions reduces your net income and then helps you qualify for more benefits. Area agencies on aging and senior centers often have staff who can help you complete your food stamps application. Don't hesitate to ask for help if the process seems overwhelming. And there is no age limit for SNAP. Many seniors incorrectly believe they are too old to qualify. The benefit continue regardless of your age. And here are some myths: that food stamp is just for families. That's not true. While 44% of SNAP recipients are children, seniors make up 12% of recipients. About 5 million older Americans receive SNAP benefits each month, but many more qualify but don't apply. Now, health food choices. Despite concerns about unhealthy purchases, SNAP recipients spend about the same amount of money on soda as non-SNAP household. Most benefits are used for staple foods like meat, dairy, grains, and produce. And then work. A large and growing share of SNAP recipients are working household. As I said before, in 2010, more than 3 times as many SNAP households worked as rely on solely on welfare. So the idea that a lot of people are just sitting home and not working and collecting SNAP, you will find that a lot of working families cannot afford food because of inflation. That is why SNAP benefits are critical to those households. And then the amount of benefits is also an issue for seniors. Even if you qualify for only the minimum amount, there's still extra food. That is still extra food. Every dollar counts when you are on fixed income, especially. So here are some resources: benefitscheckup.org. Visit the website to find over 2,500 benefit programs you may qualify for. Your local AAA or area agency on aging can have personalized help to help you apply for food stamps. And then you can visit our website, foodstampsnow.com, for comprehensive information about food stamp benefits and assistance programs. And then you can call the USDA SNAP hotline if you need immediate assistance. Now let's talk about Medicare. There are 3 things I want to talk about critically with Medicare. If you're turning 65, if you're already on benefits, I have information for you. This is driven by the headlines that I've been seeing with seniors being dropped off Medicare programs. This is from Oregon, where 25% are being dropped off plans. Just suddenly in Minnesota, it's all over the news. Why is this happening? Where we're getting headlines like this? Well, it's because there are 24,000 Medicare plans out there, and 90% of seniors are in the wrong plan. And so finding the right plan for you, for your budget, for your coverage can be hard. But then if you're in the wrong plan, it's costing you money, it's costing you your health. And we want to change that and help you change that. So there is unbiased free help. There is help. And a lot of seniors are leery of Medicare help because you're being bombarded with information. Well, Chapter Medicare, our partner, is different. Why? Because of these 3 reasons. Number one, they are the only free, unbiased medical advisor with access to all 24,000 Medicare plans. That's a big, big deal, because Medicare is location specific when it comes to plans, and your doctor network that you need, the medication that you need, the services that you require are unique to you, but you need somebody that can see all the plans that are available in your area to be able to recommend the best plan. And then the one of the reasons why I like Chapter is because their licensed agents do not work for commission. So they are not there trying to sell you the most expensive plan. They're there to help you find the best Medicare plan for you. And they can save you up to $1,100 on average. But depending on your scenario, there may be a small window for you to be able to switch to a better plan. So call the number you see on the screen, 539-205-2147, or go to the description to this video and fill out their form. They'll reach out to you. These guys are the real deal. They are highly recommended by the Better Business Bureau. They have 5-star ratings that you can read online all over the place, and they can save you money. And as I said, 90% of seniors are in the wrong plan. Chapter can help you avoid being part of that 90%. But let's talk about those turning 65, those that are retiring and leaving their job, or if you're on Medicare and you're moving out of state. I'll give you some quick rules that you need to pay attention to in order not to get yourself in a situation where you face penalties. So if you're turning 65 soon, you have 7 months window to enroll in Medicare, starting with 3 months before your birthday, your 65th birthday, and then 3 months after. Missing this period may result in late enrollment penalties. If you are receiving Social Security benefits, you will automatically be enrolled in Medicare Part A and Part B when you turn 65. No additional steps are needed unless you want to add coverage like Part D or Medigap. Now, if you continue to work and you turn 65, then if you have employer-based health insurance, check with your benefits administrator to decide whether enrolling in Medicare is the right fit for you. And then to avoid late penalties, enroll on time if you're not ready to retire, as delaying Medicare Part B and Part D can lead to lifelong penalties. If you're retiring and leaving your job, there are medical rules you have to be aware of. You have to sign up 8 months during the special enrollment period before. So if you had decided that you are not going to work anymore, you have healthcare decisions to make, and you have an 8-month window called a special enrollment period after leaving your job or losing your employer-based coverage to enroll in Medicare Part A and Part B without penalties. You will enroll in Part D within the first 2 months of your special enrollment period to avoid Part D late enrollment penalty, which lasts as long as you have Medicare coverage. That is pretty steep. And COBRA or retiree health plans do not count as creditable coverage for delaying Medicare enrollment. So sign up for Part A and Part B during your special enrollment period and ask your employer for proof of creditable coverage that is available to you so that it doesn't delay you. And that documentation is going to be important to avoid late penalties in the future. And then if you are moving, your original Medicare, which is Part A and Part B, remains valid nationwide. So there's no change there. Just ensure that your new doctor accepts Medicare before you move. Medicare Advantage plans, however, have different rules. These plans are location specific, as I mentioned. So moving out of state require enrolling in a new plan. So this original special, enrollment period that you're getting because you're moving, you can use that to get into a better part, a Medicare Advantage plan. And as I have talked about before, in all these scenarios, our partner chapter can help you sort out all the nuances of it and find the plan that is best for you. If you have Part D prescription, if you're enrolled in a standalone Part D plan, you may need to switch plans based on your new state's offering. As I mentioned, a lot of these plans are state specific. So use the special enrollment period that you've gained or triggered because you're moving to avoid penalties. And then update your information with the Social Security Administration if you're moving so that they have the best address for you to send you any news and updates that you need to be aware of. So I'm saying all this to say that Chapter can help you save money. They can help demystify Medicare. I know it's complicated, but these guys are really good. They're the real deal, and they can help you with an unbiased opinion to sort through all the mess about Medicare and find the plan that is good for you. So call them at the number or go to the description and fill out the form. And that is all I have for you today. So until I see you in my next video, thank you for spending time with me today, and thank you for watching.